Histoplasma Capsulatum lives in an environment, particularly in soil that containing large amount of bats dropping or birds dropping. When microscopic fungal inhales the spore, the illness can develop. The spore may become airborne in the demolition project area. The risk. Diseases are not the type of disease that spread like wildfire throughout human beings. Only infant, young children and elderly people are categories of people that are easily infected. This is because they have low level of immunity system to fight this fungal spore. Also, people with suppressed immune function or with chronic lung can be easily infected. And lastly, the workers who performing demolition work in area that is contaminated have high risk of having this histoplasmosis disease. Symptoms. Exposed to the fungal infection of a histoplasma, we have three types of symptoms. There is acute, chronic and disseminated. For the first symptom is acute. It's a common symptom of the histoplasmosis. That is fever, cough and headache. Okay. For the second one, this is chronic. Chronic is because the symptom has been resolved within the 3 weeks. The chronic of the symptom is example of this is a shortness of breath, the night sweat and the weight loss. And the third one is disseminated symptom. This infection can cause because the lung then can cause the effect to the other organ. For example, the enlarged of spleen, the chest pain and the feel sharp in your chest. Okay, how soon the symptom will appear? It will appear in 3 to 17 days. And how long this symptom will be distinguished? It will take a few weeks to a month. Thank you.
Let's talk about mechanism of histoplasmosis. These fungus are Histoplasma Capsulatum in soil and the material in birds or house dropping, which we call iguana. This fungus has been found in the poultry house litter, areas of carberry, cave, and the bird roof. These fungus are thermally dermophilic. In the environment, it grows as the brownish bacilla, and the body temperature it will grow as the yeast. Histoplasma spore. Histoplasma spore circulate in the air of the contaminated soils. When people breathe in the spore, they are developing risk of histoplasmosis. These are inhaled and reach the alveoli in the lungs. In the alveoli, the microphage ingest this microcordia. They are suppressed in the phagocyte. As they are thermally dermophysic, the cordia will transform into a yeast. They are survived and multiplied inside the phagocyte. So, the microphage travels in the lymphatic circulation and spread the disease over the organs in the body. So, the cell-mediated immunity of histoplasmosis is developed within 2 weeks in the immune compromised individual. This fungus is disseminated to different parts of organs such as the liver, bones, spleens, adrenal glands, resulting the histoplasmosis. Chronic disease can manifest. Okay.
Diagnosis. The diagnosis of histoplasmosis is pretty straightforward. There are 5 ways to diagnose the disease. Firstly, blood or urine test. Blood or urine test sample is taken to the laboratory to be investigated further. Secondly, doctors may conduct imaging tests such as X-ray test or CT scan test to observe any abnormalities in the body. Thirdly, a sample of blood or tissue may be taken from respiratory tract
to be investigated further in the laboratory. Next, doctors may perform tissue biopsy test in which the tissue collected and sent to the laboratory for the test. Finally, the sample can be collected to see if histoplasmosis will grow on body fluid or tissue.
The prevention.
The prevention of histoplasmosis. First, avoid expose. If your immune is compromised, avoid renovation project that might expose you to contaminated soil. Second, spray contaminated soil. Before you dig soil that likely to harbor the fungus that causes histoplasmosis, spray it thoroughly with water. That can help prevent spore from being released into the air. The third, use an effective face mask. One of the best way to protect yourself from soil-borne organisms is to wear a respiratory mask. Thank you.
The treatment.
The treatment of the histoplasmosis. The treatment usually is not necessary if you have a mild case of histoplasmosis. If the symptom is chronic or disseminated form of a disease, you likely need treatment with one or more antifungal drugs. Besides, surgery has been used to treat some complications seen in some individuals with histoplasmosis.
Okay. What was that? Did you see that? What? Damn rats. We're all gonna get histoplasmosis from all this shit in the dust. We'll be coughing up blood, skin lesions, mouth sores. Lovely.
2, 3.